The posterior triangle of the neck is an anatomical area located at the posterolateral aspect of the neck. In this video, we are going to look at the borders, the contents, the vasculatures, the clinical relevance, and also the subdivisions of this triangle. The posterior triangle of the neck has three borders: the anterior border, the posterior border, and the inferior border. The anterior border is bounded by the posterior border of the sternocleidomastoid muscle. The posterior border is bounded by the anterior border of the trapezius muscle, while the inferior border is bounded by the middle one-third of the clavicle. The roof of this triangle is formed by the investing layer of the fascia, while the floor is formed by the prevertebral fascia. Let's have a look at the contents of this triangle. The posterior triangle of the neck contains many muscles which make up the borders and the floor of the area. A significant muscle in the posterior triangle is the omohyoid muscle. It's split into two bellies by a tendon. The inferior belly crosses the posterior triangle, traveling in an superior medial direction and splitting the triangle into two. The muscle then crosses the underneath of the sternocleidomastoid to enter the anterior triangle of the neck. A number of vertebral muscles covered by the prevertebral fascia form the floor of the posterior triangle, and they include the splenus capitis, the levator scapulae, and the anterior, middle, and posterior scalenes muscle. The major blood vessels of the posterior triangle of the neck include the external jugular vein, the subclavian vein, and the subclavian artery. The external jugular vein is one of the major veins of the neck region. It is formed by the retromandibular and the posterior auricular veins. It lies superficially, entering the posterior triangle after crossing the sternocleidomastoid muscle. Within the posterior triangle, the external jugular vein pierces the investing layer of the fascia and then empties into the subclavian vein. The subclavian vein, on the other hand, is often used as a point of access for the venous system through a central catheter. The transverse cervical and the suprascapular veins also lie in the posterior triangle. The subclavian, the transverse cervical, and the suprascapular veins are accompanied by their respective arteries into the posterior triangle. The distal part of the subclavian artery can be located as it emerges between the anterior and the middle scalene muscles. As it crosses the first rib, it becomes the axillary artery which goes on to supply the upper limb. The nerve seen in the posterior triangle of the neck includes the accessory nerves and the cervical plexus. The accessory nerve, which is known as the cranial nerve 11, exits the cervical cavity, descends down the neck, and innervates the sternocleidomastoid muscle and also enters the posterior triangle. It crosses the posterior triangle in an oblique inferior posterior direction within the investing layer of the fascia. It lies relatively superficial to the posterior triangle, leaving it vulnerable to injury. The cervical plexus forms within the muscles of the floor of the posterior triangle. The major branch of the cervical plexus is the phrenic nerve, which arises from the anterior division of the spinal nerve C3 to C5. It descends down the neck within the prevertebral fascia to innervate the diaphragm. Other branches of the cervical plexus innervate the vertebral muscles and provide cutaneous innervation to the parts of the neck and the scalp. The trunks of the brachial plexus also crosses the floor of the posterior triangle. The subdivisions of the posterior triangle of the neck is done by the omohyoid muscle, and it divides this triangle into two, which are the occipital triangle and the subclavian triangle. The occipital triangle is located superior to the omohyoid, while the subclavian triangle is located inferior to the omohyoid. The subclavian triangle contains the distal portion of the subclavian artery. The clinical relevance that is associated with the posterior triangle of the neck include the external jugular vein and the cervical plexus nerve block. The external jugular vein has a relatively superficial course down the neck, leaving it vulnerable to damage. If it is severed in an injury such as a knife slash, its lumen is left open. This is due to the thick layer of the investing fascia. Air will be drawn into the vein, producing cyanosis, and can stop blood flow through the right atrium. This is a medical emergency managed by the application of pressure to the wound, stopping the bleeding and the entry of air. For anesthesia of the neck area, cervical nerve block can be used. A local anesthetic is injected along the posterior border of the sternocleidomastoid at the junction of its superior and middle thirds. This junction is where the cutaneous branch of the cervical plexus emerges, known as the nerve point of the neck. I believe this video was helpful enough. Please do subscribe, leave a comment, and like the video. See you next time.